Many patients are concerned about executive functioning, and the reason for that is there are a lot of people with ADHD who are in very high-level positions. A lot of executives, a lot of public speakers who have ADHD, and that is one of the things they struggle with the most. I think one of the biggest things to start off with is just to acknowledge some deficiencies and say, my ADHD has a lot of gifts that come along with it. Maybe I'm a great public speaker. I have just this swirl of ideas and solutions in my mind, and that allow me to elevate to this role. But when it comes to executing specific tasks or staying on time with my schedule, that's where I am deficient. So everyone has different resources available to them. Speaking more toward the executive level here, I would just recommend you surround yourself with people that can help with some of those deficiencies. So whether that's a really good executive assistant, whether or not that's someone that you bring on to delegate some of those tasks to, so you can stay focused on more decision making and let them work on execution. That's helpful as well. In your personal life and social life, I think it's important to just be honest with people and say, I need a list if you want something done for you, or I may need a reminder. It's also being honest about some of the typical things with ADHD, not only just to yourself, but in general, people with ADHD tend to be bad with poor time management. So if you ask them how long a task will take, and in reality it takes 30 minutes, they'll tell you 15, which is why a lot of us run behind. So just being purposeful about knowing that and saying, okay, I'm going to block in extra time, I'm going to put travel time on my calendar. Those kinds of things can be very helpful as well. The last part with executive function is emotional regulation, and this is a little trickier topic, but if you find yourself flying off the handle at meetings, or impulsively reacting to criticism, it's also well known that patients with ADHD sometimes have issues with this criticism or perceived criticism or conflict. That's where individual counseling can be very helpful, so I would consider doing that. And again, back to the executive level, many people will choose to involve an executive coach, which I think is also very, very helpful. They can come in and talk to people about leadership skills, and talk about some of the specific goals and meetings, and help with some self-reflection as far as what constructive and less constructive behaviors might look like in a professional role. And then talking with our providers about the issue as well, because there are some specific medications that we can do alongside the typical ADHD medications to help with some of those impulsivity issues and agitated depression issues. So there are a lot of options out there. We would love to help you sort those out.